Hello, Afroz.
Yes, sir.
You ask our students to watch the YouTube channel.
Okay, sir.
Now live streaming is coming to YouTube channel. Ask the students to join through YouTube link.
Sir, it is coming, sir. Streaming, it is coming.
Voice clarity is there?
Voice clarity is there, sir.
Okay, okay. Okay, thank you.
Hello.
Let them check now also.
ఎంతమంది లాగిన్ అయ్యారు కనుక్కోండి.
వస్తుంది సార్, చెప్తాను సార్. Sir, irrespective of number login, we will start, sir. Because ఇది రికార్డ్ అవుతుంది సార్, తర్వాత మన వాట్సాప్ ఛానల్లో కూడా పెడతాం సార్. వాట్సాప్ అండ్ యూట్యూబ్ ఛానల్లో పెడతాం సార్, డిపార్ట్మెంట్ యూట్యూబ్ ఛానల్లో. వైస్ ఛాన్సలర్ గారిది కనెక్ట్ అవటం లేదు సార్ ఇంకా.
So good morning, sir.
Sir, good morning.
Good morning, Srinivasrao. Very nice to see you.
Okay, okay, sir.
Hope that I am not late. Huh?
No, sir. You are
Yes, sir,
dot
you
on
can,
time, sir. Bhairav, I think you can start the proceedings. It is about, I think, 10.
Yes, sir. Now I am starting recording, sir. So once the recording is started, then I will start the session, sir.
Okay.
So good morning to all. So to this NAHEP sponsored virtual national workshop on application of HPLC in Pharmacokinetic Studies, I welcome Chief Patron Dr. V. Padmanabha Reddy Garu, Honorable Vice Chancellor, Sri Venkateswara Veterinary University, Tirupati, and patrons Dr. T. Chandrasekhar Rao Garu, Dean of Veterinary Science, Sri Venkateswara Veterinary University, Tirupati, and Dr. A. Ravi Garu, Associate Dean, NTR College of Veterinary Science, Gannavaram, and convener of this workshop, Dr. G. Srinivasrao Garu, Professor and University Head, Department of Veterinary Pharmacology and Toxicology, and all the faculty of SVVU. And last but not least, I welcome all the participants. And pharmacokinetics is very important in designing the dosage schedule of drugs for optimum therapeutic effect. HPLC and statistical tools like PK solver are very essential for the pharmacokinetic studies. With these above concepts, the present workshop is designed to serve with the conceptual understanding of the function of each component of HPLC and how to generate data from the animal experiments and use of the software and statistical analysis of the obtained data. So this workshop had a overwhelming response with the 362 registered participants from all over the India. So from almost all veterinary colleges, students and faculty are registered, and also various pharmacy colleges. Many pharmacy colleges from Andhra Pradesh also registered to this workshop, and also 2 international students registered, sir. So this workshop is an international workshop, sir. One is from Ethiopia and one is from US. They are registered, sir. So with this, I welcome one and all to this workshop. Now I request the convener of the workshop, Dr. G. Srinivas Rao Garu, Professor and University Head, please address, sir.
Okay. Thank you very much, Dr.
Sir,
Bharvi.
please, sir.
Good morning to everyone, to every participant who linked to the Zoom on this day for this workshop, national workshop, especially sponsored by the NAHEP, Application of HPLC in Pharmacokinetic Studies. So for this first, I would like to thank everybody, each and everybody, Honorable Vice Chancellor Padmanabha Reddy Garu, our Dean of Veterinary Science Chandrasekhar Rao Garu, and our Associate Dean A. Ravi Garu, actually who is the coordinator for the NAHEP program. He immediately told that all financial logistics for this workshop we will give and go ahead. And my colleague, Dr. Bharavi, and my PG scholars, assistant professor and contractuals in the department, really, they came forward and worked hard for a video recording of this HPLC analysis and everything, because this department is having one network project, and almost since 2008, when the PG program was started, and PhD in 2013-14, at least 10 thesis works for postgraduate students worked on kinetics, and 5 PhD scholars also worked on the kinetics of the different drugs from rats to poultry and different species. And more than that, even nanoparticularized particle pharmacokinetics also worked out by some of the students, where we used HPLC very profusely by all the students, apart because this HPLC and other equipment in this department, we got it from the ICR network project, which is still continuing, and monitoring of drug and residues and pollutants in aquatic species by ICR. Then even 2 postgraduate students also work. They got Bristol Myers postgraduate fellowship due to courtesy of our Postal Suresh, who actually initially came forward when the department started the PG program. And at the same time, we also worked on clinical trial. Actually, the first animal drug trial was done in India. I can easily say, because that is the first record on fipronil. It was done in this college with the help of pharmacology and LPM departments. Both are involved in this. So with this background and emphasis on the kinetic field, our PG scholars or students, they told, sir, why can't we make it a real-time analysis while collecting the blood and analysis of HPLC? Let us have in a Zoom conference. Then accordingly, just I went to the Dr. Ravi Garu. Then he told that, okay, we can go ahead, no problem, we'll conduct. So all my PG scholars and right from the, who is the present doing the MEC second year research, Dr. Kavya, and our student PG first year students, Susmita, Monica, Rajendra, and Moni Teresa, all these students, they worked very hard, and our assistant professor contractual Afro Jahan and Rahul. So because of their encouragement, rather, actually it is, I am a little bit first guarded, then I told, sir, we'll do it. Then after having their pursuance and Dr. Bharavi, so then I told, okay, we'll go ahead and let us see this. Sir, thank you very much, everybody. And with this introduction, I invite all the participants. We hope that with this workshop, you will get some basics of the kinetic studies and how the HPLC can be done, how the HPLC analysis will be done. Thank you. Thank you, Dr. Bharavi. Go ahead.
Sir, now I request the patron of today's workshop, Dr. T. Chandrasekhar Rao Garu, Dean Faculty of Veterinary Science, to address.
Respected Vice Chancellor Dr. Padmanabh Reddy Garu, Dr. A. Ravi, Associate Dean and Principal Investigator, NAHEP, Dr. G.S. Rao, Professor and University Head, Veterinary Pharmacology, and Dr. Bharvi, Organizing Secretary, and his team. At the outset, I congratulate the team, Dr. G.S. Rao and Dr. Bharvi and his team for choosing a very good topic for this workshop. I'm glad to know that more than 300 have enrolled on this for this workshop. I thank Dr. A. Ravi for sponsoring this event through NAHEP funds. I thank Honorable Vice Chancellor for readily permitting, giving permissions and all that. So I hope this workshop will be a very useful one as I look at the program. So it is going to throw light on the care and management for obtaining the good quality data. And another important aspects are the demonstration, virtual demonstration about the practical aspects. And the most important one is statistical interpretation of the pharmacokinetic data. I'm sure this workshop is going to be very useful for not only faculty of the pharmacology, but also the related disciplines. I wish the workshop a grand success. Thank you.
Thank you, sir. So now I request the chief patron of today's workshop, Dr. V. Padmanabh Reddy Garu, Honorable Vice Chancellor, Sri Venkateswara Veterinary University, to address.
Thank you, Bharvi. Thank you for giving this opportunity. And also I thank the organizers for giving this particular opportunity to interact with all of you. At the outset, I welcome the Dean of Veterinary Faculty, Dr. Chandrasekhar Rao Garu, Dr. G.S. Rao, eminent toxicologist, and Dr. Ravi, Associate Dean, and all the participants for this national workshop on application of HPLC in pharmacokinetic studies. But before going to this particular workshop and other minor details, I would like to congratulate the Associate Dean, Dr. Ravi, who is always encouraging this kind of webinars and workshops. I'm not hearing anything from other colleges. Let me be frank and let me put it in the record. My appreciation for Dr. Ravi. I always encourage the people who work hard and improve the visibility of the university in the global scenario or whatever it may be. We should do something. I don't expect to do very high kind of things, but we should improve the visibility of our university and get good name. If you see the ranking is very, very low. We have to, improve the rankings for this. This kind of things are going to improve. So whoever are going to work hard, they will be awarded and rewarded for sure in the coming years. Okay, that is the just only on the part of encouragement and appreciation for the people who are working. Leaving that apart, I welcome all of you to this national workshop on the application of HPLC in the pharmacokinetic studies that is being organized by the Department of Veterinary Pharmacology and Toxicology at NTR College of Veterinary Science, Gannavaram. I'm sure that the organizers would have put a lot of effort to bring the contents to the in the reach of all the participants and help them to have the awareness and also to have virtual practical experience on this particular pharmacokinetic studies. I came to know that there is a overwhelming response. Just now Bharvi was telling that there are even the international participants in this particular workshop. Really, I appreciate the organizer, Dr. G.S. Rao. And also, I came to know that on the first day, you will be emphasizing on the care of HPLC and management for obtaining the good quality data. Not only having the data, having the good quality of data is also very, very important. And also I learned that on the second day, there will be a virtual demonstration. During this pandemic, it is not possible to have the practical hands-on experience and demonstrations. So whatever the virtual demonstration that you are doing, make it a good quality one without having any interruptions, so that the participants will be having a wonderful experience with the virtual demonstration. And also I learned that on the last day, the participants will be getting familiarization with pharmacokinetic analysis of the compartment and non-compartmental models using PK solvers and statistical interpretation of the data. I sincerely hope that this workshop will help all the participants in learning the various aspects about the pharmacokinetic studies. This HPLC was always fascinating to me. Somehow, I worked on many advanced equipments when I was abroad in the USA, but somehow this HPLC was, they never came into my radar. So whenever I wanted to do data, we outsourced the analysis to the other companies. So that's why the HPLC, really, whenever I go to Gannavaram, I request J.S. Rao to show me and have a little bit demonstration on the HPLC so that I will have that particular satisfaction. I'm sure that this workshop gives a comprehensive knowledge about complete pharmacokinetic studies. With this brief introduction, I again congratulate the organizers and wish best and good luck to the participants and the organizers. Thank you very much for giving this opportunity to interact with you. Thanks.
Sir, thank you very much, sir. Now I request Dr. Afroz Jahan, Assistant Professor Contractual and Co-Organizing Secretary of this workshop, to propose vote of thanks.
Respected Vice Chancellor, sir, Faculty Dean, sir, Associate Dean, sir, NTR CVSC Gannavaram, Dr. G.S. Rao, sir, and my dear participants, a very good morning to you all. I, on behalf of organizing team, extend my thanks to Honorable Vice Chancellor, sir, Dr. V. Padmanabha Reddy Garu, and Faculty Dean, Sri Venkateswara Veterinary University, Dr. T.S. Chandrasekhar Rao Garu, for their encouragement and support. I also like to thank Dr. A. Ravi Garu, Associate Dean, NTR CVSC Gannavaram, and Coordinator of NAHEP Program SVVU, for all the financial and technical support and timely help. I extend my thanks to Dr. K. Ravi Garu, Professor, Department of Veterinary Pharmacology and Toxicology, NTR CVSC Gannavaram, and Organizing Secretary of this program, for his involvement and willingness to take on the completion of tasks beyond his comfort zone. I would like to take this opportunity to place on record our hearty thanks to Dr. G.S. Rao Garu, Professor and University Head, Department of Veterinary Pharmacology and Toxicology, and convener of this program, for his prudent planning and meticulous guidance. I also thank Dr. Tomar Garu, Assistant Professor, Department of Veterinary Anatomy, NTR CVSC Gannavaram, for his technical guidance. Dear participants, an event like this would not happen without all of your support and active participation. Thank you so much for making this a grand success. An event like this cannot happen overnight. The wheel starts rolling months ago. It requires planning and a bird's eye for details. We have been fortunate enough to be backed by a team of motivated and dedicated colleagues and MVSC scholars for their untiring effort. Once again, thank you one and all. Now, I request speaker of today's session, Dr. K. Bharavi, Professor, Department of Veterinary Pharmacology and Toxicology, NTR CVSC Gannavaram, to deliver his lecture on description of various components of HPLC and their care and maintenance for smooth function of HPLC in analysis of chemical molecules in sample. Bharvi sir. Sir is muted. रुक अनम्यूट करती हूँ. Ask to unmute.
Okay, okay. I forgot. Okay, today's my topic is on description of various components of HPLC and their care and maintenance for smooth functioning in analysis of chemical molecules in samples. So now I talk on these points. The first I will talk on in general about chromatography and types of HPLC and a brief description of their principles. And next I will talk on talk and explain in detail about each component of HPLC along with the precautions, considerations and guidelines that are to be followed to generate quality data. And next on application of HPLC system, and next method development in using by using HPLC in analysis of various chemical components. And the last one is a question and answer session. First, chromatography. So chromatography is most widely used separation, identification, and quantification of components in liquid, gases, and solid mixtures. So HPLC mainly uses liquids and gases, whereas solids first they have to be dissolved in the liquids, and then we can separate, identify, and quantify the chemical compounds. So the basic principle in chromatography is the differential affinity of components between the carrier and the stationary phase. So earlier methods, liquid mobile phase was commonly used in paper, thin layer or column chromatography. In paper and thin layer chromatography, you all know the paper used, whereas thin layer chromatography, silica gel is attached onto the aluminum sheet. Then mobile phase moving across this by a capillary force will separate the components of the sample. Whereas column chromatography, the glass column is filled with the silica gel, and due to the gravitational force, the solvents move through the column, and by moving, they will separate the various components of the sample. Whereas this liquid chromatography has played a key role in development of HPLC. The same principle is used, and with the technological advancement, the HPLC was developed. So HPLC is a major analytical technique in diverse fields such as pharmaceuticals, foods and beverage industries, forensics, clinical research, and environmental laboratories. Originally, HPLC referred to as a high pressure liquid chromatography. So as high pressure was required to allow liquid to flow through the packed columns. So there is continued advances in instrumentation and packing materials. The name was changed to high performance liquid chromatography, and with improvement in separation, identification, purification, and quantification of molecules, the name was fixed to the high performance liquid chromatography. Coming to the different types of liquid chromatographies. So there are so many, more than 10 types of chromatographies are there, but these 4 are commonly used for clinical research and pharmaceutical industries and analysis of the residues. So those are normal phase chromatography, reverse phase chromatography, size exclusion chromatography, and ion exchange chromatography. So first we will go through normal phase chromatography. It is the first kind of HPLC developed. The first HPLC developed is a normal phase 1, and here separates analytes based on their affinity for a polar stationary surface such as silica, on analyte ability to engage on polar interaction. So here hydrogen bonding will occur with a solvent surface. Uses here non-polar or non-aqueous mobile phases separates the analytes. So these analytes are readily soluble in non-polar solvents like hexane, heptane, like that. So this is the column where is just illustration, diagrammatic illustration. So this is the column. Column is a polar one. So non-polar mobile phase will run through this column. So all non-polar chemical substances, they elutate faster. They are separated. They move along with the mobile phase, whereas polar compounds that are in blue color dots, they are retained in the column. That means they move very slowly compared to the non-polar compounds. Coming to the adsorption strength. So this absorption strength to the stationary phase can be increased with the increase in analyte polarity. And more polar solvents in the mobile phase will increase the retention time of the analysis, because the solvent is also polar, and so the substances that we are eluting are non-polar. So non-polar compounds will attach more to the non-polar stationary phase. So they are retained. So whereas more hydrophobic solvents tend to induce slower structural isomer separation. That means if there are isomers, one isomer binds more to the non-polar this stationary phase, and then another isomer is more attached to the hydrophobic solvents, then they are separated. Normally in structural isomers, one isomer only will have activity, another doesn't have activity. So to separate these isomers, this normal phase chromatography is used. Coming to the usage of normal phase chromatography, so its use is nowadays reduced, not at all used, because water or protic organic solvent layer present on the surface of the silica or aluminum chromatography media will make changes in the retention time. So this layer changes with any changes in composition of the mobile phase, that is moisture level on the stationary phase, and this causes the drifting of the retention time. So retention time is not uniform in different runs. So that variation makes some difficulty in analysis of the pharmacokinetic studies, but we can use these is just to identify residues or to identify the isomers. For that purpose only it is used. So this normal phase chromatography has a poor reproducibility of the retention times. So, and of course, now it become popular again with the development of helical bonded phases, which demonstrate improved reproducibility. Coming to the so reverse phase chromatography, non-polar stationary phase and an aqueous moderate polar mobile phase is used here. And stationary phase is silica, which has been surface modified with straight chain alkyl groups such as C18 or C8 groups are attached. So normally, generally, majority of the columns that are used in reverse phase chromatography will use a C18 alkyl groups attached to the silica surface. Here, retention time is longer for molecules which are less polar, while polar molecules elicit more readily. That means here the stationary phase is non-polar, So non-polar molecules, they will attach to the stationary phase, whereas mobile phase is polar. So all polar substances, they move along with the mobile phase quickly. In that way, the separation occurs. So retention, the increases retention time by adding more water to the mobile phase, thereby making the affinity of the hydrophobic analytes for hydrophobic stationary phase stronger relative to the now more hydrophobic phases. So in a sample, if polar and non-polar substances are present, so if you increase water level, non-polar substances, they will bind to the column, whereas polar substances, they move across the mobile phase. Suppose if you reduce the polarity of the mobile phase towards non-polar, then these the non-polar substances retention time is reduced. So depending on that, we can adjust the polarity of the mobile phase. Thereby, we can separate the different components present in the sample. So this is reverse phase chromatography. So it is here the diagram. So the non-polar stationary phase, whereas mobile phase is a polar. So all non-polar substances are retained, whereas polar substances they move fast. So in such way the separation occurs. So similarly, we can decrease the retention time by adding more organic solvents to the LVM. So coming to the mobile phase modifiers, some of the mobile phase modifiers they affect analyte retention. For example, salts, inorganic salts causes a moderate increase, linear increase in the surface tension of the aqueous solutions, thereby increases the retention time of the non-polar solvents, substances. Whereas mobile phase pH also can change the hydrophobic character of analyte. You all know the pH will influences the ionization of the substances. In general, the acidic drugs are ionized in acidic pH, whereas acidic drugs are non-ionized in alkaline pH. So in such way, so we can change the ionization of the substances present in the sample. So non-ionized substances, they are more lipid soluble and they are more non-polar, whereas ionized substances are more water soluble and they are polar. So like that, by adjusting the pH, we can make the eluents polarity. Thereby, we can change the affinity of the substances towards mobile phase or stationary phase. Like that, we can make a separation of compounds present in the sample. So next chromatography is a size exclusion chromatography. So it is also known as a gel permeation chromatography. Separates particles on the basis of molecular size. So it is often reserved for the final polishing step of purification. So larger molecules simply pass by the pores. Here the column has a different size pores, that is larger pores and smaller pores. So larger molecules simply pass by the pores, thereby flow through the column quicker than smaller molecules. So smaller molecules, they are retained longer because smaller channels, they are very long and very curved channels are there, so that smaller molecules retain a longer time, so they elute later than the larger molecules. So this size exclusion chromatography, it is used for proteins and polymer analysis and also molecular weight determination of polysaccharides. So next chromatography is a ion exchange chromatography. It is based on attraction between solute ions and charged sites bound to the stationary phase. So ions of the principle here is ions of same charge as the charged site on the column are excluded from the binding. while solutions of opposite charged sides of the column are retained in the column. Naturally, in anion exchange column, all anions are retained because the surface of the stationary phase is a cation. Cation molecules are attached. Whereas cation exchange column, cation exchange column, anion exchange column, cations are retained. Cation exchange column, anions are retained. So opposite charge is present in the stationary phase. That's why the particular charge molecules are retained and other charged molecules are eluted. Like that, acidic drugs have a net negative charge and they are retained by cationic exchange column. So basic drugs, they have net positive charge. They are retained by anionic exchange column. So the retained solute ions in the column can be eluted by changing the solvent conditions. So here, by increasing the salt concentration of the solution, or increasing the column temperature, or changing the pH of the solvent, also we can adjust the retained time. So pH of the solvent have influence on the ionization. So this ionization will have effect on the retention time. Here in ion exchange chromatography, the packing material is a polystyrene resin, cellulose, and the dextran ion exchangers. These are the commonly used packing material in ion exchange chromatography. Then coming to the components of the HPLC system. So equipment appears, this HPLC system appears very complex and complicated, but once it gets familiar with components, the network of wires and plumbing tubes and circuiting, it is a very simple machine. So different components of mobile phase are the components are the mobile phase that is normally kept in the storage tank, and pump, injector port, column, detector, and displays. So these are the various components of the HPLC system. So here the mobile phase is filled, and this pump will pump the mobile phase into the stream, and there is an injector port in between the pump and the column. So here with the syringe we can inject the sample, and after that, that sample is carried through the column. Actual separation occurs in the column, and the column is surrounded by column oven to maintain the temperature. Then the separated eluted substances are detected by various detectors and displayed in the monitor. So this is the HPLC system present in our department. So these are glass bottles. We kept various solvents, so that is in measuring cylinder we keep a buffer, whereas in these two bottles the methanol and acetic acid we will keep. So this is the degasser, and this is the pump, and this is the detector, UV visible detector, and this is the column holder where inside the column is kept surrounded by oven, and this is the injector port, and this is the RID detector recently we purchased. So with these equipment, we are carrying pharmacokinetic studies in the Department of Veterinary Pharmacology and Toxicology, NTR College of Science, Gannavaram. So different combinations of above parts yields an infinite number of configurations based on the application. So to carry out this HPLC analysis, one need to have a good understanding of the parts of your HPLC system to generate data of highest reliability. So coming to the first component, HPLC mobile phase, that is kept in reservoirs. So generally the HPLC mobile phase reservoirs. So generally these are transparent glass bottles for mobile phase storage. We use glass bottles. So these glass bottles to facilitate visual inspection of mobile phase levels, to see whether the mobile phase is there or not. Otherwise, the pump will suck air, and air bubbles may trap in the column and it will spoil the column. Next, stainless steel particulate filters are provided inside the glass bottle or mobile reservoirs for removal of any particulate impurities in the mobile phase. Next, coming to the mobile phase. So this mobile phase is the lifeline of the HPLC. It is a liquid phase which is continually flowing through the stationary phase and carries the analyte with it from injector to the detector. So these mobile phase characteristics such as composition and pH have profound effect on separation of sample compounds. These characteristics of mobile phase is dependent on both stationary phase and nature of compounds being analyzed. So coming to the various mobile phases, so these are the mobile phases starting from hexane, which is a non-polar, to water. That is, water is highly polar, whereas hexane is a non-polar. So these generally consist of water and organic solvents, aqueous buffer or mixture of organic solvents with or without modifiers. This is used as a mobile phase, whereas these non-polar solvents are commonly used in a normal phase HPLC, whereas polar solvents are commonly used in a reverse phase HPLC. So whenever you are using a reverse phase HPLC, we use water, acetic acid and methanol. Suppose we want to increase the polarity, we will increase the water percentage more. So we want to reduce the polarity, then we will increase the percentage of less polar solvents such as methanol, propanol, acetonitrile, like that. Like that we will change the polarity. Suppose in a normal phase chromatography, suppose to increase the non-polarity, we will increase the percentage of the hexane or cyclohexane. Suppose to reduce the non-polarity, we will increase the percentage of this isooctane, toluene or benzene or chloroform, like that. By changing the percentage of these solvents, we can change the percentage of polarity or non-polarity. So coming to the non-polar solvents like chloroform, cyclohexane, benzene, carbon tetrachloride, these are the commonly used. Whereas the polar solvents such as water along with mild organic boosters or modifiers like methanol, acetonitrile, or strong modifiers like isopropanol, tetrahydrofuran are commonly used. So coming to, we will describe the commonly used solvents like methanol. Brief description I will give. So methanol, it is the most commonly used solvent. It is close to the water in structure and it is miscible in all proportions with the water. Next, acetonitrile, it is highly polar, has a very low UV absorbance and low viscosity. It is completely miscible with the water, but lacking in hydrogen bonding capacity. So thus it gives a different partitioning effect. That means this acetonitrile will changes the polarity of the water. So if you increase the percentage of acetonitrile, the polarity will reduce. Next, tetrahydrofuran. So this molecule has a high dipole moment and is more soluble with the non-polar compounds. So to increase the non-polarity, this tetrahydrofuran is added. So, but it degrades to form peroxides. So if we expose to the air for a longer period, so it degrades and forms peroxides, and this results in high bag pressure, increase in bag pressure, and it has a high UV cutoff value. That's why it is only used to detect a certain type of compounds only. Then coming to the water, so it is a very common solvent and an important component of the reverse phase chromatography mobile phase, and it is used in combination with the other solvents or as a buffer media. Normally water is along with water, the buffer is prepared, and this buffer is used along with the other solvents. Normally, the water purification systems are commercially available. So the water generated by such systems should be used at the earliest possible so that its quality does not degrade over storage. Normally, we use in our laboratory, we use a milq water purifying system. So whenever we are running the HPLC, just before preparation of the buffers, we run the system, we collect the water, and that water immediately we will use. And after preparation of the buffer also, we never keep stored. We will use immediately. So whenever we are running the HPLC, then we generate water, prepare buffer, and start using. We never store the buffers for future use, or we never prepare buffer one day in advance. So it is this water is used to make up solvent modifiers or to adjust pH, and also as well as ion pairing reagents. For all these purposes, water is a very important solvent. So the most important property of solvent is its ability to, so mobile phase, now I am talking on mobile phase now. So the most important property of the solvent is its ability to interact with both the stationary phase and the analytes in the mixture. So this results in a desired separation. Normally we say the stationary phase is non-polar and the mobile phase is polar. That means they are not highly difference in polarity is not there. Their polarity is slightly different, so that the substances that are eluting will interact both the mobile phase and the stationary phase. So depending on relative affinity, they are separated. Whether the substances present in the sample have more affinity to the mobile phase or more affinity to the stationary phase. If they are more affinity to the mobile phase, they are dragged first. And if they are less affinity to the mobile phase and more affinity to the stationary phase, they are retained for some time. They are not retained permanently. So they retain sometime and they are eluted later than the previous compounds. So the choice of solvents in mobile phase and the proportions of each is selected during the method development. So method development is a very important step. Coming to the mobile phase in a reverse phase chromatography. So here water is usually the base solvent, whereas other polar solvents are added in fixed or varying proportions. Mild boosters or modifiers such as methanol, acetonitrile are strong modifiers like isopropanol and tetrahydrofuran are used to change the polarity, whereas polar solvents ensure adsorption of analyte to column and not pulled by the mobile phase. So they thereby increases the retention time of non-polar constituents. So here pH is adjusted by buffers to modify separation of ionizable solutes. So I already told ionization will have effect on polarity. So non-ionized will have more affinity to the non-polar stationary phase, whereas the ionized will have more affinity to the mobile phase. So by adjusting the pH, we can change the sample constituents into a non-polar or polar. So ion pairing agents also enhance the separation selectivity of the charged analytes by increasing the retention on hydrophobic bonding phases. Water should not be used more than 80 to 90%. So this prevents the column dewetting. That means more water trapped in the column, and that will prevent the non-polar solvents to enter to diffuse through the column. So larger presence of organic solvent results in a weaker capacity of separation. So organic, there should be a limitation to the organic solvents or non-polar solvents also. If the non-polar solvents are more, the capacity of separation is lesser. The selection of solvents used in HPLC mobile phase is very much crucial and demands a deeper focus. Coming to the mobile phase in a normal phase chromatography. So typically non-polar solvents such as hexane, heptane, isooctane are used in combination with a slightly more polar solvents such as isopropanol, ethyl acetate, or chloroform. So here, the retention increases as the amount of non-polar solvents increases in the mobile phase. Coming to the mobile phase in ion exchange chromatography. So here, aqueous salt solutions are generally used as mobile phase. So here, moderate amount of water miscible polar organic solvents such as methanol can be added to the buffered mobile phase. Here, solvent strength and selectivity can be adjusted by control of pH and buffer and salt concentration. So coming to the mobile phase in size exclusion chromatography. So mobile phase composition is not varied in size exclusion chromatography. It is uniform throughout the run because a detector is sensitive to such changes in the mobile phase. So the detector mainly detects the eluent basing on the mobile phase sensitivity. So choice of mobile phase is dependent on its ability to dissolve, sample and maintain consistent viscosity at operating temperatures. Here, ion strength is maintained by addition of salts, and this should be uniform throughout the run. So if any change in the salts is occurred, that will cause a change in the detection level, and that will influences the eluents detection. Coming to the size exclusion chromatography, again two types are present. So first one is gel permeation chromatography. So this uses hydrophobic column packing material and non-aqueous mobile phase to measure molecular weight distribution of synthetic polymers. Whereas gel filtration chromatography, it uses a hydrophilic packing material and an aqueous mobile phase to separate, fractionate, and measure the molecular weight distribution of molecules soluble in water, such as polysaccharides and proteins. Coming to the precautions that are to be followed while using the mobile phase. So here always use molecule grade water and HPLC grade solvents and degas the solvents to prevent bubble formation. And of course, even though in the HPLC system itself, degasser is present, but still we have to degas the solution before keeping the solution in mobile phase storage tanks. And use a same method of mixing solvents every time, as mixing is not always additive. So here there are different mixing methods are there. So we will mix the various solvents by stirring with a glass rod, or by mixing in a magnetic stirrer or sonicator. Suppose if you mix the first time with the stirring rod, then after next time also you mix with the glass rod also. So don't first time with the glass mixing with the glass rod, and next time by mixing with the magnetic stirrer, and next time by mixing with the sonicator. So these type of mixing will have a variation in retention time. So always mix with the same method and in same duration of time also. Suppose in magnetic stirrer you mix it for 5 minutes, then next time also the same 5 minutes by using the magnetic stirrer you have to mix. So this mixing is important when you are using a isocratic mobile phase. That means same mobile phase runs throughout the run time. Then you have to take the mixing. Next, mobile phase changeover should be gradual and wash with the solvent of intermediate polarity. Suppose if you are used a highly polar mobile phase, subsequently you are using a highly non-polar mobile phase, then it should not be run immediately. There should be an intermediate polarity mobile phase should run before changing the mobile phase. And after use of buffer solutions, always wash with water to prevent damage to the pump parts by crystalline deposit on drying of the buffer contains salts. No? These salts, if you allow it to leave and dry it, then the crystals will form. They cause deposits and causes damage to the pumps and the columns. And next, do not store solvents in plastic containers. because the plastic containers may have so many substances, they may leach into the mobile phase, and that may cause some changes in the retention time. So next, glass containers. So normally we use glass containers. So glass containers are not suitable for aqueous mobile phase with pH more than 8, because the mobile phase with more than pH 8, if you store in a glass chamber, the metal ion present in the glass will leaches. So then it may cause some disturbance in the elution. That is, if the pH is more than 8, then better use stainless steel containers. Next, solvent reservoir should have small opening and should be covered, because some of the solvents they are volatile, so they evaporate. So by evaporating one solvent, other solvent concentration will increases, like that the mobile phase composition will change. That's why those reservoirs should be tightly closed. Whenever we are using oxidizable solvents like chloroform or tetrahydrofuran, they should be protected with a nitrogen gas cover. Otherwise, they oxidize and induces some problem. Then use solvent inlet filters in reservoir. So in all reservoirs, you must keep at the end of the tubing solvent filters, so to prevent any solids to enter into the column. So periodically clean solvent lines by back flushing or sonication. So this is very essential to prevent any clotting or obstruction in free flowing of the mobile phase. And it is good practice to filter solvents before use, as even HPLC grade solvents may contain some suspended impurities. Sometimes you will procure solvents 1 year back. Suppose you are using some sediments may form, we don't know. So it is always better to filter mobile phase before using. And considerations in solvent selection. So selection of solvents for use as mobile phase, it is a key component of method development, and it is not possible to have universal solvent which will meet all applications, and more than often a combination of solvents is decided based on the analysis requirement. So selection of suitable solvents is based on their physical properties and compatibilities with the sample and column stationary phase also. So this mobile phase should dissolve all the components of the sample, and also it should be closely interact with the stationary phase also. And another consideration is the cost. So cost is an important consideration, as HPLC requires superior purity grade solvents, and it is common to see that the HPLC system operating continuously to elute and detect a number of samples collected. Even in pharmacokinetic study also, we collect samples at different intervals. That is 14 collections we 14 times we collect, and 14 into triplicates, and in single animal, from single animal. Like that we will collect from group of animal. Then the number of samples are very huge. So to run such a huge number of samples, it requires a lot of mobile phase. Then we have to select the solvents which are least cost. So like that we have to take care of the economics also. So then solubility. So the sample should be completely soluble in the mobile phase, and the slightest insolubility will result in a phase separations or suspensions, which will contribute to the operational problems. The phase separation means normally the mobile phase and stationary phase, they are closely associated. And this the samples, whatever the constituents present in the samples, they should interact between and interact with both mobile and stationary phase. Suppose if they are in suspended particles, they cannot interact with the mobile phase or stationary phase. They are separated. The phase are separate. They remain in the mobile phase as a separate phase. So the solubility of the compounds we have to check before studying before analyzing. Next comes to the absorbency. Generally, the detectors used in HPLC are based on absorbance of light by sample constituents. So the intrinsic absorbance of the mobile phase components in the selected wavelength range should not interfere with the absorbance of the sample. So the mobile phase should not have any absorbance at particular wavelength, which is used to identify the desired substance. The mobile phase solvent should ideally have no absorbance at the wavelength of interest. And next one is UV cutoff wavelength. It is important consideration for deciding which HPLC solvent can be mixed with the mixed when using a UV detector. So the UV cutoff specifies the lowest wavelength that UV detector can be used for a particular solvent. So these are the various UV cutoff values of various solvent, like methanol have 205, acetonitrile 190, and in general, less than 200 nanometers wavelength should not be used. Even the UV wavelength is the 100 to 400 nanometers. So we can use up to 200 nanometers to detect any substance that absorbs UV light. So beyond UV, that is less than 200 nanometers, will give a lot of noise in the detection, UV detector. Then comes to the volatility. The mobile phase solvent should have a low volatility, especially for use with the light scattering detectors. So highly volatile solvents can lead to compositional changes in the mobile phase composition and over use and storage. So the running time is very long. So during that time, if the temperature is very high, then there is evaporation, and this leads to the change in the solvent mobile phase composition, and there is a poor reproducibility of the chromatograms. Then comes to the viscosity. So the selected solvent should have a low viscosity so that the flow through the column does not lead to the development of a high back pressure. It should be easily flow through the column. Then comes to the inertness. The selected solvent should be inert to the sample components and column packing and also column material. So any reactivity with any of these compounds can lead to the formation of precipitates, gases, or other reaction products which can upset the system performance. The solvents should not form separate phase on coming in contact with the samples. So in other words, there should be complete miscibility of the solvents. And next, filtration. This is important consideration. HPLC technique is highly sensitive to the changes in the composition of the mobile phase reaching the detector. So it is essential to filter the solvents through 0.45 micrometer filter to remove any solid suspension. So while injecting the sample also, they should be filtered through 0.5 micrometer or sometimes 0.2 micrometer filters, then inject into the column, into the system. Then degassing. So it is also an essential requirement to remove any traces of dissolved air, which can lead to flow restriction or spurious peaks. Then coming to the guidelines on use of a buffer. So pH of the buffer plays an important role in the reverse phase HPLC separations. So the change in pH influences the degree of ionization of the sample molecules. The change is minimal in case of non-polar molecules, but assumes significant in case of polar molecules, which are acidic or basic in nature. So changing the pH can be the pH change can be used effectively to separate closely spaced eluting peaks, or may even lead to merger of the separate peaks. So control of the pH through use of buffers helps in improving the separation. So by changing the pH, we can make the sample components into ionizable or non-ionizable. Depending on that, we can separate the components of the sample. Coming to the pH selection, the choice of appropriate buffer for an application in hand is governed by buffer characteristics such as pKa, pH range, and UV cutoff. So the value of these parameters can be easily found in reference text. We have to refer the literature before selecting the appropriate pH. As a general rule, the pH buffers should be used within plus or minus 1 unit of its pKa value. Within this range, the buffers resist any deliberate attempts to change in the pH. For example, the buffer having pKa value of 4.8 can be effectively used over a pH range of 3.8 to 5.8, like that. 3.8 to 5.8. In this range, we can use. So UV cutoff value should also be considered, as the detection wavelength should not interfere with the buffer absorbance. Silica-based columns should not be used outside the pH range, that is 2 to 8. So below pH 2, there is a loss of organic bonded phase, whereas on the other hand, above 8 can result in a greater solubility of a silica backbone of a stationary phase. So for such applications, columns with other packings can prove to be useful. Coming to the buffer concentration, so deciding on buffer concentration is important for method development. Ideally, the lowest concentration that gives reproducible results should be chosen. So higher concentration lead to the faster elution of polar molecules. So generally, the buffer concentration should not be lower than 0.005 molars. So below this concentration, it may not remain as an active buffer. So on raising the buffer concentration, there can be increase in buffer viscosity, which can increase the column back pressure. So normally the concentration of the buffer should kept between the 0.005 to 0.1 m range. So the concentration of the salts in the buffer should not be more than 0.1 molar. Coming to the buffer solubility, the buffer should be fully soluble in the dissolving media. At a higher concentration, precipitation can take place on coming in contact with the organic component of the mobile phase. So such precipitation can lead to the operational problems in pumps as well as blocking of the columns. So in general, it is essential for removal of any residual solid suspensions. Buffers offer their preparation and should be used at the earliest. So whenever we are using buffers, no, they should be prepared and immediately used. They should not be stored. So method development often requires a careful selection of buffers, and adequate care is required in their preparation. Coming to the considerations for mixing solvents offline. Suppose in our HPLC system, there is a provision to mix the various solvents in the online, that is during the pumping. Whereas if you are mixing before, that means there is no online mixing provision is there. We are keeping the mixed buffer. Then we have to give some consideration, that is miscibility of the solvents. So all the solvents that is used to prepare a mobile phase should be miscible with each other. That means the polarity of the mobile solvent should be similar. So remember, like dissolves like, the polarity or miscibility of all the solvent should be there. The solvent to be mixed should be miscible with each other in all proportions, as immiscible or partly miscible solvents cannot be used in HPLC analysis. So commonly used solvents such as water, methanol, acetonitrile, and tetrahydrofuran are fully miscible with each other and are commonly used in a reverse phase separation. Then come to the temperature effects. The density of the solvents varies with the temperature, which in turn affects the dispensed volume. For good reproducibility, before mixing the solvent, the solvent bottles should be kept for some time in laboratory room so as to stabilize to the laboratory temperature. Solvents seldom mix stoichiometrically. That means on reaction. stoichiometric, they chemical react. So on mixing, they occupy less volume than the sum total of their individual volumes. So because on mixing, there definitely there is change in the volume. Volume may be increased or volume may be reduced. And additionally, there can be a temperature changes as a result of mixing, which can lead to volumetric variation. The best example is mixing of methanol with water. This results in heating. There is temperature generation will occur. So the volume will increase. Whereas in other hand, acetonitrile and water mixing results in cooling. So then the volume will be reduced. So in order to compensate for the thermal changes, the same mixing sequence should be followed every time. So it is as advisable to measure required volumes separately and mix them rather than taking a volume of one solvent in a graduated cylinder or volumetric flask and making up the volume to the mark with the other one. So better you measure in separate volumetric flasks individual solvents and mix it in a other beaker rather than taking one volumetric flask first fill with methanol 40%, then mix with water up to 60%, and then mix with the acetonitrile. Like that, don't mix it. Measure in a separate volumetric flask and mix in another beaker. Then coming to the purity, so we have to use HPLC grade solvents, and this grade is commercially prepared from distillation of analytical reagent grade solvents followed by filtration. So water should be also high purity and can be obtained by using reverse osmosis based commercially available systems. Coming to the tips while using mobile phase, so the mobile phase solvent should be fully miscible with one another, and the injected sample should also be miscible with these mobile phase. When using buffers as mobile phase, components never allow the buffer to dry outside to dry out inside the system, as the salts formed on drying will deposit and cause a hindrance to the free flow of mobile phase, in addition to damage to the pump components. So at the time of changing mobile phases, take out inlet filters from the reservoir and put in fresh mobile phase and open the purge valve and purge of the earlier mobile phase completely out of the flow of the line. Like that, we have to change it and close the valve to allow mobile phase to pass to injector and to flush it. Finally, connect to the column to wash it with the new fresh mobile phase. Like that, we have to remove all previous mobile phase from the pump, from the injector, and then allow to run a fresh mobile phase into the column. And use washing solution such as isopropyl alcohol that is miscible with both previous and next mobile phase. Finally, replace intermediate washing solution with the fresh mobile phase and pass HPLC grade water to wash out buffers. So use of buffers can result in crystalline deposits. So the salts can change plunger, the salts can damage plunger or seal or shorten the useful life of the column. So that's why we have to run at least 1 hour with the HPLC grade water before and after use of the HPLC. Coming to the next important component, that is the HPLC pumps. HPLC pumps provides a continuous and consistent flow of mobile phases through its HPLC system, and it should be deliver flow of mobile phase at constant pressure and at a constant flow rate. Variations in flow rates of the mobile phase affect elution time of the sample component and results in error. This flow rate should be uniform throughout the run and run after the run. So HPLC pump has to have ruggedness and provide a reproducible flow characteristics run after the run. The operational pressure limits have a vast range depending upon analysis requirement. So in a normal analytical operation, the pressure can vary between 2000 to 5000 pounds per square inch, but in applications covered under ultra high pressure liquid chromatography, ultra high pressure liquid chromatography mode, operation pressure can be as high as 15,000 to 18,000 psi. So an ideal pump, one part. An ideal pump should have the following desirable characteristics. Of course, the manufacturer will keep a pump with these desirable characteristics, that is solvent compatibility and resistance to corrosion and constant flow delivery, independent of the back pressure, and convenience of replacement of worn out parts, and low dead value for minimum problems on solvent changeover. Coming to the common types of HPLC pumps, of course, this is not much important for us, because the manufacturer will keep an appropriate pump that is suitable to deliver a constant pressure and constant rate. That is constant pressure pumps and syringe type pumps and reciprocating piston type pumps. These are various types of pumps that are commonly used. Coming to the common types of, so these are the same thing. So coming to the pumping types, how various pumps will pump the mobile phase into the system. So here there are two types of pumping types. Two types of pumping is there. First one is a isocratic pump. So it is used in isocratic elution. So a single pump is used at various pressures and flow rates. Here, mobile phase composition remain constant throughout the procedure and is ideal for gel permeation chromatography and size exclusion chromatography applications, where run to run and day to day precision of retention time is crucial. Here, only a single pump is used. So mobile phase also the where constant single mobile phase, that is a different solution solvents are mixed together and it is kept in a reservoir, and it is a pumped single mobile phase is pumped throughout the run. Next, coming to the gradient elution pumps. Here, mobile phase composition is changed during the separation process, in which there is a sudden stepwise increase in the percentage of organic compounds will occur. That means in the initial run, the composition is different, and at the end of the run, the composition is somewhat different. Like that, during the run, the composition of the mobile phase is changes. So here, the binary pumps are in gradient elution pumps. Again, there are two type pumps are there. Binary pump. Here, two independent pumps with each pump providing flow of for a specific solvent. Here, two pumps are there, so they pump different solvents into the system. So solvents are combined in a mixing chamber. This is the mixing chamber that is located after the pumping, and then this mobile phase, that is mixed mobile phase, will enter through the injector into the column. Whereas coming to the next one is a quaternary pumps. So this uses a single pump but has a special proportionating valve to mix up to 4 different solvents for complex mobile phase gradient. Here you see this is the valve. We can change the valve proportion depending on the percentage of the mobile phase we want. Suppose we want water, that is buffer 50%, we can change that one into 50%, and remaining valves, remaining mobile phase valves to different required percentage. Here 25% of each solvents is kept, and depending on the proportion, the mobile phase is taken by the pump, and it is mixed and it is pumped through the injector into the column. So quaternary pump, we can use 4 different solvents independently, and this pump will suck the different solvents depending on the proportion you kept at the valve. Coming to the tips to be followed for efficient utilization of these pumps. So operate the system within the recommended flow rate and pressure limits to prevent damage to the seals or O-rings of the pumps. So these seals and O-rings frequent damage occurs, and this will cause us a leakage of the solvent, and this will prevent the pressure buildup in the system. So never leave a corrosive solvent or buffer in system which pump when pumping is not running. So we have to wash with the water. So change seals or O-rings periodically as recommended by the supplier, and sonicate inlet filters regularly to prevent any suspended particles from blocking the column. So prime the pump with a mobile phase to remove remnants of the earlier analysis component. So this is very important. If you directly run without removing the previous component, there may be contamination and there may be a changing in the elution order. So after using the buffer solutions, use mobile phases and run sufficient volumes of water to remove any salt deposits. Then comes to the important component, the injector. So these injectors introduce the required sample volume accurately into the HPLC system mobile phase stream. So the inertness and reproducibility of the injection are necessary to maintain high level of accuracy. So sample injection into the moving mobile phase stream requires a precise injection against a high back pressure. Normally in the mobile phase is moving in the system at very high pressure. So at that pressure, injection with a simple syringe is not easy. So to inject, we require a special device. So these are this special device in manual injectors is a Rheodyne injectors. This is a Rheodyne, that company. It is a patented one. So only injector that is available. So injection is done through specially designed 6-port rotary injection valve. Here the sample is introduced at a atmospheric pressure by a syringe into the constant volume loop. So in the load position, the loop is not in the path of a mobile phase. So by rotating, once the loop is loaded, by rotating to the inject position, the sample in the loop is moved by the mobile phase stream into the column. So it is important to allow some sample to flow into the waste from the loop so as to ensure there are no air bubbles in the loop, and previously used sample is completely washed out to prevent any memory effect. So this is the injector. We have to remove this red lid, and then we can inject. And this is the waste bottle. So we have to inject more volume than the required to fill the loop, and that waste will be collected into this waste bottle. So here is the inside the injector, inside the view, and this is the loop which will be filled by this mobile phase, and these two are connections to the column. So this is the inside view of the manual injector, and here this is the load position where we inject the sample, and the sample is filled in this, and then we turn this knob into the inject position. Then this will turn, and then the sample is entered into the stream of the mobile phase. Then it is entered into the column. This is when you turn to the side, the sample is in the stream of the pump and the column. Like that, the sample is injected into the mobile phase stream against a high back pressure. Coming to the automatic injectors, so automatic injection improves laboratory reproducibility and also eliminates personal errors. There are advanced HPLC systems are equipped with an automatic injectors along with the auto samplers also. So here the software programming is required. So with this program, filling of the loops and delivery of the sample into the column will take place. The computer also controls the sequence of the samples for injection from vials kept in a numbered position of the autosampler, and it is important to adopt precautions to ensure consistency of results and also prolong the service life of a automated system. So we have to follow certain precautions to ensure the consistency of results and to get a prolonged service life of this automated injectors. Coming to the advantages of automatic injectors, so constant volume. So in manual injection, it is prone to personal errors, whereas automated injections delivery, we can deliver a constant volume by the system. So the errors are very less. So here the injected volume can be changed as per your instructions. Suppose if you want to inject 20 microliters, or sometimes you want to inject 10 microliters only, we can change in an automated injector. Whereas manual injectors, that is not possible. And coming to the repeated injections, the analysis can decide the number of repeated injections in order to get a highest reproducibility of the results. So we can suppose same sample we can inject 3 times, triplets we can keep. But in manual injection that may be laborious, so you may not inject triplets, or so single injection per sample we may run. So next, vial selection. So mix-up is avoided as the vials are sealed and placed in a known position of autosampler, whereas in manual injection, sometimes we may select a different vial instead of the required vial. Then coming to the priority of the sample. Here, injection sequence can be set as per the analyst program. So in case there is change of priority in the autosampler sequence, we can interrupt and we can accommodate the desired change also. That provision is also there. Then coming to the wash cycles. So in between the sample analysis, the autosampler syringe and needle can be programmed to carry out required number of wash cycles. Whereas in manually, we may neglect. Sometimes we may, normally we wash 10 times. So sometimes we may neglect and wash 5 times. This may cause errors. And coming to the injection standards. So the analysis can place a standard solution in a vial, and a standard injection can be made after every 3 to 4 samples. Here, after running the 3 to 4 samples, we run a standard to verify whether the column is working normally or not. So that is possible with the automated injection. Of course, even manual injection also we can inject, but there may be a negligence possibility there. So this helps in monitoring the operating condition of the column. So coming to the analysis of a large number of samples is possible with the automated injector. So autosampler tray can accommodate around 100 vials. So this is a big advantage as the analyst can load the number of samples as per the analysis requirement in a single step. So this will saves the time. So the analyzer, the operating personnel can concentrate some other task. So the availability of extra time so that we can take care any other work. So work output will be improved by the operators. Coming to the suggestions for a smooth functioning of a injector. So prime injector with the solvents to be used, but it should be ensure that the solvent is compatible with the solvent used earlier. So needle wash between samples will prevent carryover between injections. So before the start and at the end of analysis, ensure tubing is completely washed off buffer or previously used solvent. And do not forget to feed the vial number correctly on the auto sampler rack, or list out the sequence correctly. Otherwise, there may be chances of errors. So next, flush the injector with the mobile phase to remove any memory effect, and it is better to flush with the isopropanol in between the analysis and keep the injector in load position only at the time of sample injection when using the manual injector. So injector tubes and loops should be rinsed sufficiently before subsequent analysis to prevent any cross-contamination, and rinse automated injection system needles with water or isopropanol wash cycle to remove any, that is same in manual or automated injection. Coming to the HPLC column, this is a very important component. So column is a stainless steel tube packed with a stationary phase. So it is a vital component and should be maintained properly as per the sampler instructions for getting reproducibility, separation, efficiency, run after the run. So HPLC columns are expensive, and if you take precautions in use and storage, you will get a long service from them. So this is the column, HPLC column, that is 250 millimeter length. So here arrow mark is indicated. So depending on the arrow, you have to fix exactly in the flow rate, flow of the flow according to the flow of the mobile phase. And this is the inside view of the column. So this is the oven and column is fitted. So here the principle in the column is partitioning of the sample molecule between a mobile phase and a stationary phase in the HPLC column is based on the affinities, which tend to hold back some molecules while allowing others to pass through the freely. That means some molecules which have more affinity to the column are retained, and the molecules which have less affinity are moved along with the mobile phase. In that way, the column separates the various constituents present in the sample, various molecules present in the sample. So the HPLC column stationary phase is the where separation occurs, and it is the most important part of the system. And coming to the different types of analysis are classified based on type of stationary phase and mechanism behind the separation in the column are first reverse phase HPLC column. So majority of the HPLC applications are covered under this reverse phase chromatography, and here the stationary phase mostly comprises of non-polar alkyl hydrocarbons such as C8 or C18 chains bonded to the silica or other inert substances. So this is a C8 structure, alkyl structure. This is the C18 alkyl structure. That is the 18, this 17 plus this is one column 18. So C18 column is the most commonly used for chromatography analysis. So in the C18 column actually can handle more than 60% of the application in most HPLC labs. That is, most of the more than 60% of the applications uses the C18 columns. Whereas here the mobile phase is a polar, and the elution order is a polar followed by less weakly polar and non-polar substances eluted at the last. Whereas the normal phase HPLC column, so here separation are opposite of the reverse phase separation. So the stationary phases are polar, having either plain silica or organic compounds such as amino, cyano, etc. groups bonded to the silica-based supports. Here mobile phase are non-polar, such as hexane, heptane are used, and here also the small quantity of polar modifiers such as methanol or ethanol are also used. So here the elution order is the first non-polar compounds are eluted, and next weakly polar, and last polar substance are eluted. Here the principal mechanism behind the normal polar, normal phase or reverse phase chromatography is the interaction. The interaction in separation is a polar interaction. So differences in polarity between the sample components and the bonding entities on the stationary phase results in the preferential retention. So depending on the polarity of the substances, they will interact with the mobile phase or a stationary phase. Depending on that, they are retained or eluted. Coming to the ion exchange chromatography column. So ion exchange chromatography columns are available with the matrices having either strong or weak functional groups. The strong anion exchange matrix is a quaternary ammonium and is designated as a Q, whereas a weak anion exchange matrix is a diethyl aminoethyl. And of course, there is the intermediate strength resin, which contains primarily tertiary and some quaternary amines. It is also available. And these anion exchange columns are used for separation, isolation, and purification of charged compounds, such as larger biomolecules like proteins and polysaccharides. And there is a wide choice in the selection of column type, size, and different strength of the functional groups. So ion exchange columns are available in wider working pH ranges. With a strong anion exchange columns provides the ability to use pH to change the net charge of target molecules to make them bind more strongly, more weakly, or not at all. So in an anion exchange column, packing is positively charged, therefore retains negatively charged molecules by Coulombic interaction. Coulombic interaction means the interaction between a different charged ions. So bound molecules are eluted with an anion gradient and usually achieved by salt gradients with common ions or a phosphate or sulfate or carbonyl or chloride ion. These are used to elute the bounded ions. So this combined with the optimized bonding and elution conditions, and anion exchange column chromatography can be used at all stages of biomolecule isolation and analysis, including initial cleanup, purification, separation of proteins, amino acids, and nucleotides, and also removal of contaminants such as endotoxins, host cell proteins, and ionic compounds. So these ion exchange column chromatographies are mainly used in separation, purification, and isolation of proteins, especially the vaccine proteins, bacterial proteins, and viral proteins that are used as a vaccine, and even in purification or preparation of heparin or immunoglobulin preparations. These are used. And ionic exchange columns are available at different sizes, starting from small sizes for a screening purpose, and next process validation, and even different stages are used to separate or manufacture or prepare different volumes. And finally, for commercial production, the large size, that is 150-liter columns, are also used in the vaccine manufacturing. Mainly these ion exchange chromatography columns are used. So proteins having multiple charge groups, and it is the overall charge or pi in a given buffer that determines whether how strongly the molecules will bind to the column stationary phase. So you know the proteins are Zwitter ions. They contain both charged, positive charged and negative charged groups on either side. So whether to bind the particular protein to the anion exchange column or not to bind is determined by its pi. That is, pi is nothing but an isoelectric point of the protein. It is the pH at which the net charge of protein is 0. So 0 means it will not bind, it is eluted. So depending on changing the pH to the opposite direction, the proteins may bind to the stationary phase or elute along with the mobile phase. Like that, the proteins are separated. All the proteins may not have the same charge. The different proteins have different charges. So depending on the pH change, the proteins are separated. Then comes to the size exclusion chromatography column. So here separation takes place on the basis of molecular size of the size. So small molecules get trapped in the stationary phase force and exit after the larger molecules. So there are no chemical or ionic forces involved in the separation. So these phases are available with the silica or zirconium backbones with the heavily cross-linked polymers. So used for separation of larger molecules such as polysaccharides, peptides, proteins, and the polymers. So these are separated by using the size exclusion chromatography. So here the principal mechanism of separation is the molecular size. So here this is the column. So there is a big channels. So larger molecules can easily pass through these channels, whereas the smaller molecules they are trapped in the smaller pores. So they remain for a longer period. They eluted at later. So coming to the HPLC column, the column length with the same stationary phase has a significant effect on the separation. Suppose the longer the column, so longer the retention time or longer the journey time. So long and wide columns can take a higher sample load and provides a higher resolution. On the other hand, shorter columns reduce analysis time and resulting in lower mobile phase consumption. Coming to the suggestions to improve life of the column with reliable results. So first one is never use column as a stirrer and take care not to subject to mechanical shock as the packing can be irreversibly disturbed. And next, always avoid overloading the column. For analytical columns, the sample load should not be more than 500 micrograms. Avoid sudden change in operating conditions such as pressure, flow rate, etc. And always choose guard columns for protection of the columns. And on changing columns, change to the recommended guard column. So this guard column will filter unused substances or any impurities that block the column, actual column. So at the end of the day, remember to carry out washing of the column. This is very important. One has to wash the column at least minimum for 1 hour with the HPLC water. So in case column is taken out of the system, do remember to fix the end caps. So all, two ends of the column should be closed if you remove from the system. So before storage, purge of solid salt deposits and buffers, and for long time storage, always store column in a manufacturer recommended solvents and close the ends of the column with the T caps provided by the manufacturer. So use column with the pH range 2 to 8 as a column begins to deteriorate faster outside this pH range. So the pH range that can be used with the columns is 2 to 8. So beyond this range, the column damage will occur. Coming to if the column is spoiled or not eluting properly, then we can restore the column's eluting capacity. So there are certain restoration procedures are there. So the HPLC column is capable of giving a highly reproducible performance run after run for months together. However, if it has a finite lifetime, the lifetime is not forever. There is a limitation. So after some time, there is a deterioration in the column performance. There is a changes in the peak shapes and resolutions. So then we have to go for the column restoration to regain its capacity of elution. So column can be restored if it becomes fouled due to the overloading or use of incompatible mobile phase. But a damaged column or one that has outlived its useful life cannot be restored and would require to be replaced. So coming to the restoration procedure for reverse phase column. So reverse phase separation is the main operational mode used in the majority of the HPLC system. So the packing material mainly comprises of the C18 or C8 or a cyanide or a amine or phenyl stationary phase. So here column should be in restoration procedure. This column should be eluted with 10 to 20 volumes of the solvent. That means if the column capacity is 5 ml, we have to use 50 to 100 ml of the this following solvents in a sequence. So that means first 50 to 100 ml of water we have to pass to the column, then followed by acetonitrile, then followed by isopropanol, then followed by heptane, then followed by isopropanol, and acetonitrate, and last with the mobile phase. So in this sequence, each solvent should be passed at 50 to 100 ml through the column. Then the column is restored. And after restoration, the equilibrium, we have to equilibrate that column with the HPLC grade distilled water. So the equilibrium time for 250 millimeter length column is 60 minutes, whereas for 150 millimeter length column is 30 minutes. Here the flow rate should be 1 ml per minute. So at 1 ml per minute flow rate, we have to equilibrate column for 30 minutes to 60 minutes. Whereas coming to the reverse phase columns, which are used proteins to separate proteins or peptides, here we have to flush with 20 volumes of mobile phase without buffer, followed by 0.1% trifluoroacetic acid in water and followed by 0.1% of trifluoroacetic acid in acetonitrile or isopropanol, and finally equilibrate with the mobile phase to be used for subsequent analysis. Whereas column restoration procedure for normal phase columns. So normal phase columns, we can flush with the 20 volumes of these solvent in a sequence. First heptane, then isopropanol, then acetonitrile, then water, isopropanol, and lastly by heptane. So like that, if you flush it, the column will be restored. Whereas coming to ion exchange columns, so ion exchange columns are restored by passing these solvents, that is first 20 volumes of 50 millimole phosphate buffer, then followed by 10% acetic acid, then followed by 5 volumes of water. Like that in this sequence, if you allow to run, then these ion exchange columns are restored. Coming to the this gel permeation column or gel filtration column, the 50 column volumes of 0.1 phosphate buffer at pH 3 can be used to restore, and if strongly retained proteins are present in the column, then we can use a 60-minute gradient from water to acetonitrile to water. That means initially the water is run, and subsequently the percentage of water and acetonitrile changed to reach 100% acetonitrile, and then subsequently we run with the gradient by reducing acetonitrile and increasing the water percentage, and finally the 100% water is run. Then this GPSC or GFC columns are restored. Coming to the storage of HPLC columns, so HPLC columns should be stored under ambient temperature condition, and never store the columns in refrigerator or oven. So it should be kept in a room temperature. So storage conditions will depend on a time interval between the use. Suppose we are storing for short time or overnight, so we can store in a solvent as a we can store with a solvent that is used for the last analysis. Even we can keep the column in the system itself by running the last mobile phase that is used. Suppose if you want to store medium interval, that is days to weeks, then flush with pure water to prevent microbial or mold growth. So run with HPLC grade water, and we can store even in the system itself for 2 days to few weeks. Suppose if you want to long term store the column for a prolonged period, that is for months together, then it is better to remove column from the system, and before removing so elute with the use eluent which should not contain more than 50% water, preferably with aprotic solvents like acetonitrile. First you elute with this acetonitrile, and never use soap or detergent solutions, and strong acids or alkalis cannot be used, and they may damage column irreversibly. And during storage, end plugs should be tightly fitted to prevent solvent evaporation, and this leads to drying of the statement. So for long-term storage, preferably you fill the column with acetonitrile and plug the both ends of the column, then you can store for a very long period. Coming to the validation of the column before use, so new column or even after regeneration, it is important to validate the performance of a restored column by verifying its performance parameter such as a high equivalent to theoretical rate. So there is some procedure is there. The column entire length is divided into various plates. So depending on the plates, we have to estimate the peak height and area. There is a asymmetry factor and there is a retention times. So all these parameters should be evaluated. So you evaluated using the standard various standard compounds. Then coming to the guidelines in use of a column. So install the HPLC column so that the flow directions matches the direction of the arrow. The mobile phase should be degassed prior to use, and it should be filtered in 0.5 millimolar filter. Even though if you use the online filters also, the previous before keeping the mobile phase in mobile phase storage, we have to filter and equilibrate the column with the mobile phase which is compatible with the manufacturer's storage solvent. That is, manufacturer's storage solvent is isopropanol alcohol. So we first use mobile phase which is compatible with this and use at least 5 to 10 volumes of equilibrating mobile phase. So before storing, rinse the column to remove any residual buffer or ion pairing agents. So this is essential to prevent degradation or buffer salt deposition on drying. So recommended pH range of the silica based column is 2 to 8. So some columns permit a range of pH 1 to 11 also, but for safe operations, long column life, so you should use the pH range between 2 to 7.5 only. When changing the mobile phase, the selection of solvents should be gradual in terms of polarity and avoid drastic changes or extreme gradients. So a reverse flush can be used if excessive back pressure develops. If back pressure is rising, then better to reverse flush to remove any blockages or sediments present in the channel. So filter all samples through 0.45 or 0.2 micrometer filters prior to the injection. Coming to the guidelines in use of the column, use a guard column between the injector and analytical column to prevent contaminants and parameters, contaminants.
Hello.
Parvi sir, shall I share the screen?
No. It started now.
Okay, sir.
Is it visible?
Yes,
It is. No, so you can start sharing now.
so start sharing your screen, sir.
Mm.
Okay, is it visible?
Yes,
Yes,
yes.
sir, visible, sir.
Go ahead.
Okay, sir.
So guidelines in use of column, use God column. The same slide as I had, I think.
Yes. You can go ahead with the same column, same slide.
Okay.
Okay.
Guidelines in use of a column. So use God column between the injector and analytical column to prevent contaminants and particulates from reaching the column. So use mobile phase for dissolving the use mobile phase for dissolving the sample, or if it that is not possible, then another solvent or mixture of the solvents of compatible polarity should be used. Suppose if sample is not dissolving in the mobile phase that we are using, then you dissolve in a mobile phase that is compatible with this mobile phase. So never exceed the prescribed temperature limits, and for consistency of results, use column oven, because in our tropical area the temperature fluctuation is there. In summer temperature is very high, and in winter temperature is very less. So during if the temperature is varies, the retention time, elution time will be varied. So the temperature should be uniform throughout the run, and then only you will get a good quality data. For that, HPLC should be kept in air conditioned room, and the temperature variation should not be there. One second. Hello? Hello? Hello, is it visible? Audible? So,
Audible, sir, and screen also visible.
okay. Variation of temperature during the analytical run can result in change of retention time of the separated eluting components. So a column oven maintains the constant column temperature using air circulation. So this ensures a constant flow rate of mobile phase through the column and prevents a drift of retention time of the peaks. So the set temperature should be maintained within the recommended by the supplier, and keep the oven clean, and periodically check the connections to ensure that there is no blockage of airflow to the oven. Coming to the detector, so this is the last and important component of the HPLC. So the detector gives a specific response for the components separated by the column, and also provides the required sensitivity. So the detectors capable of establishing both the identity and concentration of eluting components in the mobile phase stream. So it has to be independent of any changes in the mobile phase composition, and majority of the applications requires UV visible detection, though detectors based on other detection techniques are also popular these days. So mainly we use a UV visible detector. And coming to the types of HPLC detectors. So these detectors are broadly classified into the bulk detectors and the solute property detectors. So first, bulk property detectors. So these react to the bulk property of analyte and measure the changes in solute and mobile phase in combination. So this shows the fluctuations in readings even with a slight change in the mobile phase composition. That means the mobile phase reading, it will constantly reads, and any changes in the mobile phase ionic concentration or any other substance, that is, it will read as a extra to the mobile phase rate. So the mobile phase composition should be constant throughout the run. So example of these bulk property detectors are refractive index detectors, electrochemical conductivity detectors, electrochemical detector, and light scattering detectors. Coming to the solute property detectors, so these are also called selective detectors because they give a response for a particular physical or chemical property. So it is ideally independent of the mobile phase. Suppose if the mobile phase is changed during the gradient illusion, then it will not be affected. So whatever the mobile phase, so it will detect only the substances present in the mobile phase. So these are again broadly classified into UV visible detectors. So here again there are three types: fixed wavelength detectors, variable wavelength detectors, and diode array detectors are there. And next, fluorescent detector, infrared detectors, and other detectors like transport detectors, chiral detectors. Chiral detectors are mainly used to identify the isomers and corona discharge detectors like that there. So first, electrical conductivity HPLC detector. So these measure the conductivity of the mobile phase along with the solute. So it will senses the ions whether they are from a solute or from a mobile phase. Here the principle is electrical resistance it will measure, and the measured electrical resistance is directly proportional to the concentration of the ions present in the solute. So next detector is a refractive index detector. So these are based on the changes of the refractive index of the element from the column. So with respect to the pure mobile phase. So this used for non-ionic compounds, that is neither fluorescence nor absorb UV light. So they are often used as detectors for high performance liquid chromatography and size exclusion chromatography. Then comes to the UV visible detectors. So these are the most common because most of the compounds they absorb UV or visible light, visible region of the light. So they give a specific response to class of compounds or particular compounds depending upon the functional group of eluting molecule. So here again the fixed wavelength. So only one preset wavelength is present. Of course, not at all used nowadays. And variable wavelength detectors, so we can adjust wavelength at all range of the UV visible region, and whatever the wavelength we require we can set at that wavelength, and we can detect the compounds which are absorbed light at that wavelength. And next, coming to the diode array UV visible detector. So it is a sample is in this detector, sample is subjected to light of all wavelengths scattered by the lamp at once. So this helps to see the response of the analyte at different wavelengths in only single run. That means in single run, the compound is subjected to the different wavelengths, and at different wavelengths, what are the different compounds that are present are identified. So normally if you set a single wavelength, whatever the substances that are absorbed light at that wavelength only detected, whereas other substances the eluted at the same time which absorb different wavelength light are not detected. So that is the advantage of the diode array UV visible detector. At the same time we can detect a number of compounds. So this is mainly used to identify any impurities, background impurities that are present, or any other substances that are eluting at the same time. So next comes to the fluorescence HPLC detector. So these are most selective, sensitive, and specific than all other HPLC detectors. So here specific wavelength is used to excite and then emit light signal in analyte atoms. Here fluorescence is 10 to 1000 times sensitive than UV light. UV are strong UV absorbing compounds. It is more sensitive. Even minute quantities can be detected with this fluorescent detectors. So for compounds which do not have fluorescence absorbance or low absorbance, they can be treated with the fluorescence derivatives such as dancyl chloride. So for this, the post-column derivatization attachments are there. So that will mixes this dancyl chloride into the stream. So this dancyl chloride will attaches to that eluting compound, and that after binding they will emit a UV absorbance light, blue in fluorescence light. So based on the property of compound to absorb infrared, infrared HPLC detectors. So these are based on property of compounds to absorb infrared light such that it falls in the region of 4,000 to 6,000 centimeters rest minus 1. So this is useful for polymer analysis as it differentiates secondary structures. So next come to the data acquisition and control of a HPLC system. So modern HPLC systems are computer based and software controls operational parameters such as mobile phase, composition, temperature, flow rate, injection volume, and sequence, and also acquisition and treatment of output are all controlled by the software. And the main parts of a basic HPLC system with in more advanced HPL system contains some additional attachments like solvent selection volume, degasser, auto sampler, column switches, and pre and post column derivatization and fraction collectors. Coming to the application of HPLC system, HPLC has contributed to analytical solutions in diverse fields such as pharmaceuticals, food industry, life sciences, environment, and forensics. And HPLC, particularly a reverse phase HPLC, is the most popular choice for a quantitative analysis in pharmaceutical industry. And this provides a reliable quantitative precision and accuracy along with a high linear dynamic range to allow determination of active pharmaceutical ingredients and related substances in a single run. So coming to the application of HPLC system in pharmaceutical industry, it is used to analyze analysis of assays and related substances estimation and analytical method validation, stability studies, and compound identification and working standards. Whereas in food industry, this HPLC is used or applied for various compounds identification like fat soluble vitamins and water soluble vitamins, residues of pesticides and antioxidants, sugars, even glucose, fructose, maltose analysis, even cholesterol and sterol estimation, we can use this HPLC. Even dyes, synthetic colors, even we can estimate mycotoxins from the food, various food substances. Even we can analyze amino acids and residue antibiotics, steroids or flavonoids, all these substances we can estimate by using the HPLC. Coming to the method development using the HPLC system, so availability of different types of columns, operating parameters, mobile phase composition, diluents, and pH values make it critical to develop an analytical method. So common HPLC method development steps are selection of HPLC analytical method, selection of chromatographic conditions, and parameter optimization. So first one, selection of HPLC analytical method. Here, sample preparation is very important, and tomorrow, that is the next session, you will know how to prepare the sample, and in briefly select a method to prepare the sample according to its solubility, filtration requirements, extraction requirement, or other special requirements to make a clear solution of HPLC analysis. And briefly take a sample, clean it and mix it, and prepare a homogenate with equal quantity of HPLC grade water, and then add 0.5 ml of 20% trichloroacetic acid in acetonitrile and vortex it for 1 minute, and then centrifuge at 10,000 G for 5 minutes at 4 degrees centigrade, and transfer 0.5 ml of clear supernatant to the other vials and add 0.5 ml of 5% aqueous acetic acid or 0.01 molar aqueous oxalic acid, mix thoroughly and filter through 0.22 or 0.45 micrometer syringe filter and then inject that sample. And then comes to the chromatography. So in reverse phase chromatography, so this uses most of the samples, but when acidic or basic molecules are present in the sample, reverse phase ion suppression or reverse phase ion pairing should be used. So here stationary phase should be C18 bonded column. Whereas coming to the normal phase chromatography, this used for low or medium polarity analyte, especially when it is required to separate the product isomers, and choose cyano-bonded phase for normal phase separation. Whereas coming to ion exchange chromatography, best to use inorganic cationic or anionic analysis, and also for separation, isolation, and purification of proteins, this ion exchange chromatography is used. Whereas coming to size exclusion chromatography, it is best if analyte has a high molecular weight, like polysaccharides or other substances. Coming to the gradient or isotonic HPLC. So gradient HPLC is helpful in analysis of complex samples having a number of components and has a great sensitivity and higher resolution with the constant peak width, especially for the products having a longer retention time. Whereas the isotonic HPLC, the peak width increases with the retention time. So gradient means the solvents percentage will changes with a different elution time. Whereas isotonic HPLC means same mobile phase runs throughout the run. Coming to the column size, normally 100 to 150 millimeter column are used for most of the samples. So this 150 to 100 millimeter column reduces the method development and analysis time for the samples. Whereas bigger columns are used for complex samples, those took more time in separation. So initially, flow rate should be kept at between 1 and 1.5 ml per minute. So normally flow rate is 1 ml per minute, whereas the column particle size should be between 3 and 15 micrometers. Coming to the HPLC detectors, if analyte has chromophore that enables the compound to be detected by UV visible light, then it is better to use UV visible detector. It is always better to use a UV visible detector than other detector, because UV visible detector you can detect the majority of the compounds. Then coming to the fluorescence or electrochemical detectors, it should be used for trace analysis. Then samples having high concentration should be analyzed using the refractive index detectors. Like that, we have to select the detectors. Next, select wavelength, appropriate wavelength. So we have to estimate lambda max of the samples. So lambda max is the wavelength at which there is a highest absorbance to a particular substance. So a wavelength lower than 200 nanometers gives a more noise, therefore it should be avoided. Coming to the next selection of chromatographic conditions. So after selection of analytical method, different chromatographic conditions are selected. So the flow of analyte through the column depends on the concentration of the solvent in the mobile phase. So the concentration of the solvent is generally used to control the retention time. So mobile phase pH and ion pairing reagents also affect the retention time of the sample. So samples having a large number of components are analyzed using gradient to avoid the larger retention time. So gradient elution is used if the many number of compounds are present. So we in gradient system, the first one mobile phase is passed, in which the desired component is retained, whereas the others are eluted and removed. So later on, to elute the retained component, we change the mobile phase combination so that the desired component also eluted later. So the samples having a large number, while the samples contain 1 or 2 compounds, then we can use a isotonic system. Coming to the parameter optimization, once above two steps are standardized, then run the same sample to optimize some parameters like column dimensions, particle size, and runtime and flow rate. It is done to get the best resolution and minimum runtime. So after proper optimization of the analysis method, it is validated to ensure the consistency of analytical method, and analytical method validation is now done mandatory by all regulatory authorities. So validation is a very essential nowadays. So with this, I conclude this description of various components of the HPLC system. Now,
Thank you, Dr. Bharvi, sir, for your excellent and informative presentation. Thank you once again. Sir, now I will be we will be seeing the chat box whether participants are having any queries. We will keep questions to you, sir.
Okay.
I think, sir, participants, they are not having any queries.
Okay.
Thank you so much,
Thank
sir,
you.
for your nice and informative presentation.
So tomorrow the session lecture is by Dr. Afroz Jahan. So it is on a virtual learning session on the pharmacokinetics of a drug in chicken. Okay, thank you very much. So I'm stopping.
Bharvi, sir. Sir, I think feedback as a like what is called link itself. It's better like if you post into the YouTube chat box, sir. Because that feedback form we have posted, but the thing is it is like a word text it is coming, not like a link. Google form link, sir.
Where from Zoom?
Sir, YouTube itself you have to post, I think, sir.
No, I asked Rajendra to place in YouTube.
Okay, sir, that we. Okay, my dear participants, feedback form link will be sent to your mail as well as WhatsApp group. Sir, there is one question, sir.
Okay.
That is post column derivatizers are compulsory for detection.
Yeah, post column derivatizations like are compulsory to detect the compounds which are not detected by UV light or some fluorescent substances which emit very low fluorescence. Then we add some post column derivatizations like they are nothing but they inject into the stream dancil chloride like substances. They bind up to the substance like any protein molecules, and after binding they emit a fluorescent light. Like that we can detect the substances which are not detected by UV light or fluorescent detectors. There are different attachments are there. Depending on our requirement, we can add into the HPLC system.
Okay, sir. Thank you so much, sir.
Okay, very good presentation by Dr. Bharvi. It's really comprehensive. You have given everything so that people knowing that pumps and other things and detectors, what are the importance of columns and what is the precautions you have to take to maintain the instrument. It completely covered all the way. Rather, it is very exhaustive. Probably rather very exhaustive, but it will be very nice presentation, and all the basics of the components were described and detailed. and it is very informative and educative also for the most of the beginners of the HPLC. I thank for that, such a nice presentation. Okay, over to Dr.
Thank you,
Bharat.
sir. Thank you, sir. Thank you very much, sir.
I think tomorrow we can go ahead with the next lecture. Okay.
Okay, sir. Okay, sir. Thank you, sir. So I am ending the session,
Okay.
sir.
Okay. Okay.